so we're going to switch gears a little bit here, and we're going to start talking about delegation. Now, this information is in your pink review book on pages 13 and 14. So when considering delegation, we always need to keep in mind those 5 rights: the right person, the right task, the right circumstance, the right direction, and the right supervision. So let's look at a scenario and see what tasks are missing. The RN asks the UAP to ambulate with a client who is 2 days post-operative. The RN tells the UAP the client should ambulate 20 yards every 2 hours. So what are we missing from this scenario? You guys are right, supervision and direction. So as far as supervision goes, we need to tell that UAP when to report to us. Every 2 hours, end of shift, whatever that should be. The second thing that we're missing, what should they report? You have to be explicit in your directions. So we need to know if the client tolerated it. We need to know if the client didn't tolerate. And what does that mean? They became short of breath. They dropped their oxygen saturation. Perhaps they felt lightheaded. And then the directions. What directions are missing? Elizabeth. Can't hear you? Yes. Do they need an assistive device? They're 2 days post-op, crutches, cane, walker. And the other thing that we need to know, is this a 1-person or a 2-person assist? We have to give complete directions when we're going to delegate to make sure that things are done safely. All right, let's look at some questions about delegation. A nurse cares for a client with terminal lung cancer. Which actions should be delegated to the UAP? Select all that apply. So remember, we are applying our test-taking strategies with each and every question. So select all that apply. We're going to treat each item listed as a true-false. Ask yourself, is this true or false? The other thing we need to do, we're going to apply that stop strategy even here. What is the story? Well, in this case, our issue's delegation, and our client has terminal lung cancer. And then remember, we're going to think. This one is a positive stem, right? So we're going to look for what? Yes, Maria, we're going to look for the right answer. And then what are our key words here? Patty. You're right, delegation and UAP, that's what we need to know. And then you're going to consider every option, and remember, we're going to pick and stick. So here we go with our options. 1, encourage the client to express feelings about the terminal diagnosis. 2, assist the client to ambulate to the bedside chair twice a day. 3, demonstrate to the client the proper use of a bronchodilator inhaler. 4, complete vital signs that include oxygen saturation every 4 hours. And 5, obtain a urine specimen from the client's indwelling bladder catheter. Everybody get your numbers back out. We'll take just a few seconds. I'm seeing a lot of correct answers, you guys. Good work. For those of you that picked 2 and 4, you are correct. And let's talk about the options in case anybody didn't get this right. So encouraging the client to express those feelings. Well, here's the thing about that and what makes that a false statement. RNs and PNs have had training in therapeutic communication. So if that patient says, I just wish I wouldn't wake up in the morning, we're going to pull up a chair, we're going to sit down, and we're going to say, tell me more. Tell me how you're feeling. And the UAP, remember, they've had no formal training. So we have to make sure that we're not giving them something that they cannot handle that's outside of their scope. All right, so number 2 is correct. We are assisting with ambulation, right? And that's correct because that's an ADL, and that is in the UAP scope of practice. 3, demonstrate the use of a bronchodilator inhaler. Well, the reason this is a false statement, demonstrate, that's teaching. And then a bronchodilator inhaler is a medication. So those are 2 things not within the scope of a UAP. Option 4 is a true statement, vital signs. That is something that is within the scope of practice for a UAP. And then obtain a urine specimen from the client's indwelling bladder catheter. Why can they not do that? Josephine. Yes, it's a sterile procedure. It has to be a licensed nurse to do a sterile procedure because remember, we're accessing the hub in the catheter and not that Foley bag. All right, nice work, everybody. Let's do another one. A nurse cares for a group of clients on a medical surgical unit. Which client should be delegated to the LPN? Select all that apply. So again, we have a select all that apply. We're going to apply that true, false, and we're also going to apply our stop to this as well. So here's your options. Newly diagnosed diabetes mellitus type 2, facial lacerations and a subdural hematoma, bronchitis receiving bronchodilator treatments. Option 4, exacerbation of myasthenia gravis admitted 3 hours ago. 5, advanced regular diet, 2 days post-operative cholecystectomy. All right, get those cards out. Wow, you guys must have all had your Wheaties this morning. Everybody's doing a fantastic job. 3 and 5, those are your correct answers. So that bronchitis, that's a stable patient, and a bronchodilator treatment's within the scope of an LPN. Advanced regular diet, 2 days post-op cholecystectomy. I mean, a lot of people have their gallbladder out and they go home within a few hours. So that is a stable patient. The advanced diet tells us that they're progressing and they're working towards discharge. So that's appropriate to delegate. Now, let's talk about the false statements here. Number 1, newly diagnosed with diabetes mellitus type 2. So newly diagnosed implies a lot of teaching is going to be involved, right? And RNs do the initial teaching. And with a condition like diabetes mellitus, we're going to be talking about diet and meds and activity. That's just a lot of teaching. All right, option 2 is false. Facial lacerations with a subdural hematoma. Anytime you see a head injury, you need to think that the RN has to care for this patient. That is an unstable client that's going to require a lot of assessment. We're going to be doing regular neuro checks with this one. So that patient is unstable. That's why we cannot delegate that to the LPN. Now, option 4, exacerbation of myasthenia gravis admitted 3 hours ago. So exacerbation means acute. And then that's 3 hours ago we got that admission. So there's probably still work to be done that the RN's going to have to handle. Now, what is it with myasthenia gravis? Why would we be extremely concerned in that acute phase? Doug. You're exactly right. Doug said respiratory issues. So myasthenia gravis, in the acute phase, they have that muscle weakness. And that muscle weakness can lead to respiratory failure. And that can happen very, very quickly with these patients. All right, nice work, guys. All right, let's talk about scope of practice. And again, this information is page 13 and 14. And the other thing, there's a great activity for you on the top right-hand corner of page 13 that can let you practice some more of this. So let's talk about a UAP. What can a UAP do? Jay. Yes, ADL. So what's included in an ADL? Grooming, hair, oral care, bathing. They can assist with changing of the clothes in an ADL. This is your ambulation. This is your toileting. This is your transfers. What else can they do? Mark? Absolutely. We just talked about that. They can obtain vital signs. They can also get your weights, and they can also collect data for your eyes and O's. And safety, that's a big one. UAPs are qualified to handle safety issues. And what do I mean by that? I'm talking about the bed in low position, call bell within reach, those possessions are within reach, they leave the tray table next to the bed. It could mean turning on a bed alarm or non-skid socks. Those are all things that are safety related. All right, let's talk about LPNs. What can they do? Remy, yes, you are correct. They can do vital signs. So what does that mean? What would we call that in consideration of an LPN? We would call that data collection. So we need to understand that distinction. Registered nurses do the assessments. LPNs do the data collection. So that implies they're not making decisions on any of that. They're simply collecting yes or no, there are bowel sounds. They're not making any decisions or any interpretation based on that. Our LPNs take care of stable clients, and they reinforce teaching. So the RN gives the initial teaching, the LPN can reinforce that. The other thing that LPNs can do, they can collaborate with the plans of care. So again, the RN will set up the initial plan of care, but then the LPN is going to share information with us to make changes. Now, something else I want to mention with LPNs, IVs. So LPNs can do a dressing change on an IV, right? Because that's a sterile procedure, and licensed nurses all can do sterile procedures. They can calculate drip rates. They can monitor the flow on an IV drip. The other thing they can do, they can administer IV piggyback. Now, I'm talking about normal saline, running at 125. You have a 2 o'clock dose of azithromycin that's going to go on a Y connector tubing, and there's no disruption. LPNs cannot flush a line, start a drip, and discontinue and flush that line again. That is not within their scope of practice, but that IV piggyback run on Y tubing is something that they can do. All right, so the RN, what's in our scope of practice? You're right, Michelle, we do the assessments. We also will be responsible for any unstable clients. We will do the teaching, and we will initiate and maintain those plans of care. All right, let's do a practice question with this. So a nurse assigns 4 clients to the LPN. Which findings should the LPN immediately report to the nurse? A client receiving long-term antibiotics who has a rash in his left groin, baseline regular apical pulse of 88, who today has an irregular apical pulse of 120. Option 3, a client who has a recent diagnosis of terminal cancer and refuses to eat or participate in hygiene care. And the final answer, option 4, 8 hours post-laparoscopic surgery who reports abdominal distension and shoulder pain. Okay, you guys apply your STOP strategy and hold up those cards. All right, so here we go. Answer 2 is the correct answer. 88 to 120, that's a normal value to tachycardia. And then we have regular to irregular, so that's a big concern. That is something that necessitates an RN assessment. Remember our ABCs? That is going to be a circulation issue. All right, number 1, long-term antibiotics, and then the rashes in the left groin. So those are your keys to why that's not the correct answer. Antibiotic therapy is going to cause a reaction with that first dose. The other thing, those rashes are typically truncal. They have urticaria, and then they also have petechia. This is not going to be isolated. If it's isolated, and especially to the groin, I'm starting to think yeast. Has that antibiotic set up a situation where we now have a yeast infection? All right, option 3 is incorrect because we have a patient with a diagnosis of terminal cancer, and they just got this recently. So that client is grieving. That client might not want to eat or might not want to get a shower. And then 8 hours post-laparoscopic surgery with abdominal distension and shoulder pain. So that is a perfectly normal finding, right? With that laparoscopic procedure, they've put gas in the belly, so that belly is distended. And then you think about what happens to gas. Gas rises. So shoulder pain, that gas is rising from the belly. It's going to take a little bit of time to move around and get that absorbed and get that out.